News Channel 8 presents New Skills for Living with your host, Tom Lavin, a healthy plan for healthy living.
Hello and welcome to New Skills for Living. We want to thank you for joining our show, which is dedicated to healing and wholeness in our community. You're probably very interested in the evolution of healthcare here in the state of Nevada and what things are going to be developing to serve our citizens. And we have an excellent guest with us today to talk with us about how healthcare services are going to continue to develop and evolve here in Nevada. Our guest is Richard Whitley, who is the administrator of the Division of Mental Health and Developmental Services. He is also the administrator for the Division of Health, and as the administrator of the Division of Health, he is directly responsible for promoting and protecting the health of all Nevadans. As the administrator for the Division of Mental Health and Developmental Services, he oversees public and private network of programs involving mental health, substance abuse, and developmental disabilities. Richard, thank you so much for joining us on New Skills for Living.
Thank you.
Yeah, it's great to have you with us. So I've been hearing that as we're evolving here in the state of Nevada, we're looking at integrating public health and behavioral health and mental health. Can you tell us about the possible title of the new services and what does this mean in terms of the evolution of our services here, Richard?
Sure. From a state perspective, the integration of what's historically been called mental health and developmental services and state health, integrating public and behavioral health into a single agency, which, in some ways isn't very novel. People have been doing this forever, being both mind and body, and it's really only when we implement programs that we categorize services and sometimes make it difficult for people to access because they have to get in multiple lines to get services.
Yes. So can you tell us a little bit more, maybe practically, your vision of how this integration is going to occur and the difference it might start making in people's lives?
Sure. I think it'd be important to start with what really public health is, and it's important to note that public health is different than health care in so much as it's more population-based. So it's really looking at the systems of service, and the focus is really on prevention if possible. So if you can prevent something, intervene at that point. If not, screen and detect early, and if then services are needed to provide quality services. So prevention, intervention, and treatment are really the three concepts, with really the emphasis on prevention whenever possible. And I think that sort of concept brought to behavioral health is an important one. I think that historically the need for services have been so great that the idea of sort of pausing to say, how could we go upstream from this and perhaps intervene earlier or even prevent the onset of mental illness or substance abuse, that we just haven't really taken full advantage of those opportunities. The other element that I think public health brings to behavioral health is the use of data. Most of us in Nevada are used to data being used to tell us we rank the lowest in many health indicators. Although I'd have to say that we are making progress in many areas, perhaps not as quickly as we would like to see. But what public health does is it looks at data to actually identify where those intervention points are, so where you could prevent or intervene earlier. And prevent, either tragic outcomes or more costly outcomes. And I think this will really enrich the behavioral health system as we look at the whole person. We know that people with mental illness die at an earlier age than the general population from conditions that are preventable. They die from many of the same conditions: heart disease, stroke, cancer. But what we've identified is, in most cases, they're not intervened with or identified until later, often through emergency room visits, not through primary care or through a family physician, because the systems haven't been connected.
So that someone with a physical health issue might get that treated, but their mental health issue or their substance abuse hasn't been and vice versa, Richard. Someone with a mental health diagnosis, their physical condition frequently isn't looked at or treated, and we have about 30 seconds. So what can you tell us about that, about integrating this so that the whole person is looked at?
Well, I think what's most current or on the horizon is the Affordable Care Act and the implementation of the Affordable Care Act, which brings with it a payer source for the population that has been historically seen in the state mental health system. Those consumers will have coverage for primary care.
Great.
So the challenge will be getting them access then to those services.
Getting them access, and I'm sure that's a topic that we will return to as we continue to talk with Richard Whitley today. Hello and welcome back to New Skills for Living. You'll see up on your screen the website easeap.com, where if you would like to watch Richard's interview again, his interview will be up there in streaming video. Also other people like Steve Hayes, Mike Wilden, Dr. Victoria Follett, Dr. Barbara Kohlenberg, a host of over 30 shows that you can watch to take a look at how to deal with depression and anxiety, and then our interview today as well with Richard Wilden. I also want to, Richard Whitley, I'm sorry. I also want to mention to you that there are newsletters up on the website, over 90 newsletters dealing with mindfulness, depression, and anxiety. So Richard Whitley, our guest for today. We were talking earlier about the importance of working with the whole person, Richard. Can you tell us more about that?
Sure. I think, it really is having the systems of service catch up to the individual, and so that when we're treating someone, their presenting problem may be a mental health issue or a substance abuse issue, but behind that are, they're a whole being with other health conditions or risks, and taking advantage of that opportunity to refer them and assure that they're getting into care so that their whole body can be treated if needed, or help to be kept well. I mean, I think that wouldn't it be wonderful at some point that we're in working with people with severe mental illness that we can focus on wellness.
Yes.
Our environment is such that we could actually encourage exercise and nutrition and
Yes.
Other behaviors that could lead to overall wellness. And I think really with the Affordable Care Act and the expansion of our Medicaid system and that payer source for our clients, the opportunity is really there for us to provide additional services to really a group of people with mental illness who haven't always had those services made readily available.
Yes. So is there going to be like a central point in the evolution of healthcare here where someone will walk into a primary care physician's office and there'll be like an interdisciplinary treatment team there to assess and triage and begin to treat the whole person? Or what is the vision for how we're moving with this, Richard?
The intent would be that the system is tied together and that it's more deliberate than it currently is. I mean, I think what happens now is often relationships in terms of referrals are made and kept, and it kind of works not on purpose. But the intent is that no matter where somebody enters, if you enter through your primary care doctor for, say, maybe for a flu vaccine, and you have other presenting problems such as depression or another mental condition that needs to be followed up on, that a referral can be made at that time. So the expertise may not be contained in the primary provider's office, but the formal network of how to refer, but most importantly, I think that screening opportunity. We did it with several, a decade ago, started with tobacco, with smoking, so that primary care physicians incorporated into their practice, do you smoke? If yes,
Yes.
have you thought about quitting?
Yes.
Let me refer you in. And so that every encounter, included those questions. And, I think the hope is that the same will occur with behavioral health. And so, how are you doing? And, have you noticed anything? And then if there is something there, to make a referral and get people into service. Again, as I said previously, early intervention. If you can't prevent it, then let's intervene early.
Yes.
I mean, there's not a vaccine for all conditions, which is probably the best example of a preventive health approach. But there are strategies and evidence-based programs, and the failure really has been the inadequacy of the service system for identifying and referring in. And so we're hopeful that with affordable care and the payer source that we can tie the system together in a more formal way.
Yes. I really like what you were saying there, Richard, and I think one of the themes that maybe we might return to is the empowered client or the empowered patient or empowered consumer. And we'll talk with Richard right after this brief break. Hello and welcome back to New Skills for Living. So Richard, we were talking about how and where people might access help in the system. And of course there are people that are more strongly or heavily involved in institutions, and they get their health care through different institutions or social agencies. Can you tell us a little bit about the vision for this in this part of the 21st century?
Sure. I think another benefit of taking a public health approach was looking at the data. In public health, we often look like with diseases and outbreaks of disease, we look at how it spreads, but we don't often use that same approach for social service issues to look at, where the issue is occurring and perhaps what's causing it, what are the determinants. And so when we looked at the mental health data, we saw that, almost 20% of the people in our jails had been clients of our state mental health system. In Washoe County, 17% of the inmates in the Washoe County Detention Center had been clients of Northern Nevada Adult Mental Health Services, either an outpatient or inpatient. Carson City, it was a little higher at 20%, and in Clark County at their detention center, it's about 10%. But in Washoe County, what we did was look further to see how many of those folks, cycle through jail and hospitalization and emergency room, and why, and where could we intervene. And some of the failures, I would say, of the system were pretty simple fixes, or suggested simple fixes, like leaving jail with 3 days worth of medication and not having an appointment for 30 or 60 days. And tragically, in many cases, people were stabilized while they were in jail, back on their medication, stabilized, and discharged with not enough medication to hold them over until they had an appointment at an outpatient clinic. And so we have fixed that. So at Washoe County at the detention center, we actually built off mental health court, that same model, and expanded it so that we could actually improve our discharge planning. But that's a population that, when I spoke previously about the payer source, well, that's not going to touch this population in terms of, they're passing through, much like homeless people, they're not accessing traditional systems of care. So we have to construct non-traditional systems to serve. And some of that is connecting systems together. Jail, prison, homeless shelters, these are all areas where people may have an underlying mental health condition or substance abuse issue and may not access traditional services. So we need to do outreach in those areas. And if people go through those systems, how to connect them back. And so that's, I guess I refer to that more as a failure between systems. It's not any one system. Each system's doing what it's supposed to. The jail is serving the client while they're incarcerated. The outpatient services are serving them while they're outpatient. The emergency room is seeing them when they're brought in. The hospital is treating them. But each one of those work in such isolation, and tying them together in a more formal way to make them work, that's all doable and not very costly, really. And so it'll be interesting over time when we look at the data to see how the impact in terms of preventing hospitalization and reincarceration by just intervening at that tail end.
And I think the mental health court at NAMS has received some national recognition for what a good job they've done And I would imagine you would say that's a great example of integrating care and intervening. And can you tell, a lot of people, though, may not know about mental health court. Can you tell us a little bit about how that works?
Sure. I mean, first, it is a model program. It actually gave us the building block to launch these other programs off of with law enforcement. But I would actually classify it as really an early intervention where people becoming involved with the criminal justice system and being identified with a mental health condition that probably a growth opportunity for mental health court is to be looking at misdemeanor mental health court, where perhaps you have a younger population and earlier onset identification of mental health. But I sort of, in my mind, applying a public health approach would look at a mental health court as early intervention, and then the population that I was speaking of in terms of probably the chronically mentally ill who law enforcement intervenes with, who aren't eligible for mental health court but then get put in jail and are charged with crimes, sometimes just nuisance crimes or crimes of just really needing law enforcement to intervene with. That those folks really are needing to be intervened with and to be stabilized for the long run.
That's excellent, and we'll continue to take a look at the evolution of healthcare here in the state of Nevada right after this brief break. Hello and welcome back to New Skills for Living. We're talking with Richard Whitley, the Administrator of Health for the state of Nevada and also the Department of Mental Health and Developmental Services. Richard, there is a hot topic nationally and then also in our state, and that's the issue of firearms, which is a huge public health issue. Would you share with us your perspective, your concerns, your vision around that issue, please?
Sure.
Okay.
I think, from a public health perspective, we would view firearm safety as injury prevention. And I guess it would be most analogous to vehicle safety. That if you think about it, you have the car, the driver of the car, and the road, and all the rules of the road. Well, with firearms, you have the gun, you have the person who shoots the gun, and you have the environment in which that occurs. And so it's complex in that no single strategy can actually prevent injury or harm, but it takes multiple strategies. I think you mentioned it's a hot topic, not only nationally but in our state. I think it's important to not link it so much to mental health that, or the mentally ill. The mentally ill, the data would indicate that the mentally ill are most often the victim of violent crime, including firearms, and not the perpetrator. But these high-profile cases certainly do get the attention. I think, again, taking a prevention approach, one thing that we've done most recently is worked with NAMI, the Nevada Alliance for the Mentally Ill, North and South, to work with family members about educating them about firearm safety and what they can do in the living environment in which the severely mentally ill reside.
That's great. Can you tell us a little bit about what they did do at NAMI? At their meeting?
Sure. We brought in instructors on firearm safety and actually provided trigger locks and security techniques for how to actually, if you're going to possess a firearm, how to secure it, and not waiting until the client is perhaps a danger to themselves or others, but creating a safer environment, focusing on the home, that environment as a place where an intervention can occur. I mean, so much focus is on the gun or the person, but a lot can be done just in the environment by making it a safer environment.
Now, if we go back to this idea of going back to making healthcare more accessible to our citizens, a couple things that people frequently run up against, and I was hoping you might address this. One is, it's difficult for some people to reach out and say, I need help. Another is stigma. I'm ashamed to ask for help Could you address those two issues and how socially we might get past that and know that it's okay to have an illness and it's okay to ask for help? Could you talk a little bit about that, Richard?
I think on the being offered help or engaging in the opportunity for help, I think the integration of primary care and public health and behavioral health, so that every opportunity is an encounter to screen and early identify. I think that that's a helpful change in our healthcare system, so that you may be going because you have a physical concern, but if an inquiry is made about your mental health status, that's an opportunity. So I think that will help. I think that will also help change the culture, that it's okay to talk about, that you don't have to anguish or wait or keep confined to your family, the challenges that you might be having with a mental health condition, because it's talked about. I think the more an issue that's stigmatized can be discussed openly and treated like a chronic condition. People have diabetes, people have cancer. There are treatments and recoveries that people can make. It's the same with mental health. Mental illness can be treated, but it can only be managed and treated when identified. And so having more of discussions, programs like yours where topics are discussed, I think will go a long way to changing that culture and improving the stigma.
Richard, we have about a minute left, and you're very optimistic and very positive about the direction we're moving in. What would you say is the greatest opportunity for us in the state of Nevada to live a healthier life as individuals and as families?
Gosh, that's a big question.
It is.
I think it's an openness of exploring what are the things that keep us from being healthy, whether it is an individual or a family, and in healthcare and overseeing the quality of healthcare. We do this thing called root cause analysis, where what's the underlying cause?
So that's a great point that you're making, and we want to thank Richard Whitley for being our guest today. Again, this show will be on streaming video in the future, and we want to invite you back to be with us next month as we continue to take a look at new skills for living.